I think vaccination has become really divisive.
A huge part of nursing is about conversation and education and how to connect with patients.
First thing would be, have you gotten your COVID vaccine? And if the answer is no, you can say, can you tell me why not? Do you have any questions?
So when you say it's the flu, it's not really the flu.
I wish more patients engaged as deeply with maybe their chronic disease, diabetes, heart failure, as much as they are about vaccine. The conversations we could have around health would just be amazing.
I mean, I'm healthy. I don't need it.
So what are a few reasons why you think you don't need the vaccine?
We're teaching the students to be able to communicate with people, whether it's their patients, their family, their friends, using motivational interviewing strategies, which really helps to determine what the person's ambivalence is and what their motivations are for change.
Because I'm their family, I'm their mom, so they want me to be healthy forever. So they knew this is not good, please don't take it.
Do you think that if we provided you with some resources, your family would be open to a conversation about the vaccine?
What we're learning is that when patients feel heard and understood and that their opinions and ideas matter, they're a lot more willing to learn and kind of open their ears.
It's classes like this that really help me feel more confident about having those conversations, not just about COVID-19 vaccine, but also about vaccines in general.
You're going to learn a counseling technique. I think there's a variety of reasons why people are hesitant to get the COVID vaccine. That can range from concern that the development happened too fast and so that it may not be safe. Some people have linked this behavior into their political beliefs and arguments.
COVID-19 has really disproportionately impacted communities of color, not having insurance, being poor, not being documented.
In my presentation, I focused on medical mistreatment of African Americans in the United States. So we have this historical medical mistrust. So all this happened before, then all this happened with COVID, and now you want me to go get that vaccine? I don't think so.
We're in a different information age than we were 40 years ago, right?
Good evening from our CBS newsroom in New York.
Walter Cronkite was the guy who told us the information. Now people with social media, anybody can have an opinion and post it, right? And so part of this grant is helping the students to identify credible sources of information and to be able to, identify with the patients and their community members. What are your trusted sources?
The School of Journalism helped us develop the modules on vaccine information versus misinformation, and they helped us develop modules on communication strategies, health communication strategies, and health literacy, and media campaigns.
We need to figure out a common message that we're going to use across the board, so that way we have consistent branding throughout. The students' mission is to create a campaign that can be used to fight vaccine hesitancy in several rural counties in Missouri. How do we stand up on the public health side of things?
Is Pfizer going to be on the top and the Moderna on the bottom? The media campaign's going to be great because it's just going to show the people in the community the importance of getting the vaccine, just correct education on what it is and how they can support their community through that.
I can take out the blue here and maybe see how.
This has been fun. This has been fun work. We have put together a good team of people and we work well together, and we feel like we're doing really meaningful work, and it really highlights the Sinclair School of Nursing and the good work that we do in the state of Missouri and helping improve Missourians' health outcomes.